Welcome to the P3D Juniors podcast. I'm your host, Catherine Balser, and with me is my co-host,
Abby Walker. On the camera, we have Ruby Wayne, and on the soundboard, we have Parker Warford.
P3D is a youth group here at JCMS focused on substance prevention facilitated by the Prevention Department. Can you please introduce yourself and tell us who you are with?
I'm Rachel Klocke. I'm with Jersey County Health Department and the Jersey County Ross Council.
What is your background in the health field?
So I have been a nurse for nearly 10 years. When I began my career, I worked in St. Louis in the NICU. And before having kiddos, I also worked a second job here in town over in the ICU at the hospital. I've been with the Jersey County Health Department for the past 4 years. I work back in the Maternal Child Health Department. And then most recently, as of July, I also took on the role as the Jersey County Ross Coordinator.
What is ROSC and what does it stand for?
So ROSC stands for Recovery Oriented System of Care, and what we are a group of community members who are working on building a community that is inclusive and supportive of those in recovery. So we don't provide services, people don't come to us for treatment, but instead we're working on building relationships among existing providers and organizations to make it easier to access care. With that being said, people still contact me via email, call me asking for where can I find this type of group, or hey, I hear you guys are doing this Suboxone shot, and I just remind them that's not us, but let me give you the information. So people are always welcome to reach out to me for those types of things.
What was the process like receiving the ROSC grant?
So like any other grant, it's not an easy process. I think it took close to 2 years. We're funded through the state of Illinois, so we had to fill out applications, proposals, and then prove to the state that we deserved it. So unfortunately, but fortunately, there has been an ongoing and increasing opioid-related death and overdoses here in the county. So it's very much needed.
Was that a difficult process?
It was. I mean, it took a couple of years. It wasn't just an overnight process.
Can you talk about what is a warm handoff and how it is implemented?
Sure. So we are actually working on developing a type of warm handoff program here in the community. Warm handoff is more or less a personal face-to-face transition of a patient from one care provider to another. So an example would be a patient comes into the ER and upon discharge, rather than being handed discharge papers with a phone number to call that they're probably just going to throw away, we're going to connect them with a provider, whether that be our MAR provider in town, scheduling an appointment there, a treatment provider out of town, or a service provider within the community, such as a community peer recovery specialist. And that's somebody who has lived experience, they've walked the path of recovery, they know those steps, and the goal is for them to build a trusting relationship with those people so we can increase more people reaching treatment and recovery.
It seems people who have addictions are unwilling to ask for help or hesitant to admit it. What's your opinion on what an addiction is?
So I believe that addiction is a disease. Addiction changes the way that the brain works, like other diseases change how organs work. So the brain's reward system, how you feel, what makes you happy, it actually gets rewired from these substances, and eventually it just craves that feeling from those substances more and more, to where a person, they start to weaken self-control. While they may realize that this isn't good for me, it's harming me, it's very hard for them to stop.
There's normally two big reasons. What are those reasons?
Two of the big reasons that people don't seek care is, one, they feel like they don't need it, and two, there's a lot of stigma surrounding substance use. So people are either embarrassed, afraid, or ashamed to even ask for help.
Wow, very interesting. Do you have any opinion on the fentanyl crisis going on?
Yes, so the fentanyl crisis is real and it's real scary. I don't think people realize how just a small amount can be deadly.
Have you had any dealing with these cases?
Yes, so while I worked at the ICU here in town, I mean, there were several different instances where young individuals would come in overdosing on fentanyl-laced drugs, so they had no idea that was in there. And then I also, while working in the NICU, I was on the neonatal abstinence team. So what that is there was a team of nurses who took care of babies who were withdrawing, born addicted to substances. So we actually had an instance where parents were allowed to come in as long as up until discharge. If they were clean, they could come in at any time. But there was actually a mom who was found using on the postpartum floor, so she was no longer allowed in our unit. She was able to send down a bag of like baby blankets and clothes down, and a couple of our nurses handled those items and it sent them to the ER because they were exposed to fentanyl. It takes, just the smallest amount, like as big as the tip of a pencil. And then again, here in the field that I'm in now, sadly, there's been a couple kids who have survived, but they've gotten into fentanyl, or it's touched an object that had been touched by fentanyl in the home and overdosed as well.
Wow.
Were you involved with the cuddling program at the hospital?
So I wasn't involved personally, but we worked with them in the NICU. So Cuddlers, it's a volunteer system. People can go through training to learn how to support nurses on pediatric floors, and working on the NAS team, we utilized it frequently. Those babies, much like most adults, they had the same withdrawal symptoms, and they were very, very irritable. So you would spend an entire 12-hour shift with them screaming the entire time. So that's when we would call in our cuddlers. Sometimes babies wouldn't even like to be touched or held, I should say. So those ones that couldn't be held, they would just what we call touch hold, and just that calm human touch was enough to calm them.
What is something you would like to express or share with the viewers so they can better understand and hopefully overcome the stigma?
Sure. So I just want to remind everybody that addiction is a disease. It's not something that people choose to do. It's not a moral failing. I feel that a lot of kindness and compassion goes a long way with this. And the more that we talk about recovery, addiction, substance use, I feel like the more that's talked about, normalized in daily conversation, that people hopefully feel more comfortable with reaching out and getting the help that they need.
We'd like to thank you for being here, and we hope you much in your success in your future.
Thank you.
Funded in whole or in part of the Illinois Department of Human Services, Division in Behavioral Health and Recovery through a grant in the Substance and Mental Health Administration.